Bartholin's glands normally are two pea-sized glands deep in the perineum, sa puerta. They are located at the entrance of the vagina at 5 o'clock and 7 o'clock position. A normal Bartholin's gland cannot be palpated, hindi po nakakapa. The Bartholin's duct are approximately 2 cm in length and they open in a groove between the hymen and the labia minora in the posterior lateral wall of the vagina. Secretions from the Bartholin glands are responsible for sexually stimulated vaginal lubrication. The gland secretes fluid that acts as a lubricant during intercourse. The fluid travels down the tiny tubes called ducts into the vagina. Around 2% of adult women develop enlargement of one or both glands. More than 82% of women who develop enlargement of the Bartholin glands do so during their reproductive years. In my experience as OBGYN, majority of my patients who had this problem are in the age group of 30s. At meron din pong buntis at naoperahan ko po siya because she can hardly walk. Kinakarga na po siya ng asawa niya going to my clinic. In women over the age of 40, enlargement may be caused by the rare adenocarcinoma of Bartholin's gland. The mean age of discovery of a Bartholin's gland carcinoma is 50 years old. So pag meron po kayong mga bukol dyan sa puerta, magpa-check up po kayo kaagad sa inyong mga friendly OBGYN. Now you will ask, what is the cause of Bartholin's cyst and Bartholin's abscess?
Duh.
The most common cause is cystic dilation of Bartholin's duct. The problem is obstruction of the duct secondary to chronic inflammation or infection and trauma. As a consequence, the balloon duct produces a swelling in the vestibule adjacent to the posterolateral margin of the hymen. Yes po, pag nagbara po yan at hindi nyo po naagapan, lalaki ng lalaki po ang cyst at bubukol siya na parang kayo ay mayroong scrotum. Bartholin's cyst can become infected, forming an abscess. It becomes painful when an abscess develops. Yes, napakasakit na po niyan pag nagkaroon ng pamamaga at nagkaroon nga ng nana. An infection tends to be polymicrobial and there is a gonococcal involvement in 20 to 30% of cases. Bacterial culture of fluid from Bartholin's duct, cyst, and abscess contain a wide range of bacteria similar to the normal flora of the vagina and the rectum. What are the signs and symptoms of Bartholin's cyst or abscess? Most women with Bartholin's duct cyst are asymptomatic. Yes po, may mga kababaihan po kaming nakikita na walang nararamdaman except may nakita lang silang bukol sa kanilang puerta. So pag mayroong local symptoms of acute pain and tenderness, they are secondary to rapid enlargement, hemorrhage, or secondary infection. Common symptoms are vulvar pain or masakit ang puerta, dyspareunia, masakit pag nagko-contact, and pain during walking, masakit pag naglalakad. The abscess is fluctuant and the associated edema may produce enormous swelling of the entire labium, meaning pwede pong mamaga ang buong kanang bahagi o kaliwang bahagi po ng pisngi ng inyong puerta. So magmumukha po kayong mayroong balls. How long do Bartholin's cyst and abscess last? Well, it can stay in place for up to 6 weeks. You will feel better right away after the fluid is gone. Bartholin's cyst may come back and need treatment again. Yes, marami po akong nakitang bumabalik para magpagamot ulit kasi po ayaw nilang magpa-incision. Gusto nila gamot lang, antibiotic lang, takot po kasing magpa-opera. Kaya po bumabalik. Without therapy, most abscess tend to rupture spontaneously by the 3rd or 4th day. Now, how do we treat Bartholin's cyst or Bartholin's abscess? The treatment of infection or enlargement of Bartholin's gland depends on their symptomatology. Asymptomatic cysts in women under the age of 40 do not need treatment. The treatment should consist of bed rest, sufficient analgesics to relieve the pain, local thermotherapy, or hot seat bath. You can soak it in warm water for 10 to 15 minutes several times per day for 3 to 4 days. This can help the cyst to open and drain on its own. It requires drainage if it impairs walking or intercourse. Simple incision can be done in a prominent area where there is only a very thin layer of tissue encapsulating the abscess. When the abscess formation is evident, incision with drainage affords immediate relief. A large opening should always be made in the cyst and its walls, prevented from coaptating and closing for about 2 weeks. Classic surgical treatment is to develop a fistulous tract to marsupialize the duct. Huwag po kayong magtataka pag kayo po ay inaoperahan at may nakita po kayong opening na naiwan dun sa area ng inyong incision site kasi po iniiwan po talaga namin yan ng bukas para mag-drain pa po ang nanang natitira at kusa po yan magsasara. Recurrence rate following marsupialization is approximately 5 to 10%. An alternative surgical approach is to insert a ward catheter. A catheter is inflated inside the incision and then it is left there for 1 to 2 weeks or 3 to 6 weeks. It will allow for thorough drainage to facilitate healing and reepithelialization of the cavity wall. Such a device is particularly suited for recurrent Bartholin's abscess. Incision and insertion can usually be done with sedation, analgesia, and local anesthesia. So, mga sis, mga moms, wag po kayong matakot magpa-check up pag may napansin na po kayong bukol dyan sa puwerta nyo. Wag nyo na pong hintayin lumala at hindi kayo makalakad bago kayo pumunta sa doktor. Hasta la vista! Thank you for watching my video.